tachycardia, panic and distress, you get hyperventilation, really, really unpleasant side effects. Hi everyone, and welcome back to the Chemicals Couple podcast with your hosts Jess and Lee. This podcast contains our own personal experiences as well as our opinions, and so all of the information that we're about to give you should not be used in substitute from seeking advice from a registered health professional. So let's get into it. How are you feeling?
I'm good, thanks. You?
Yeah. So this is the last episode of our 4-part series of alcohol. Probably the most pharmacy-related one that we've ever done on the podcast. We're going to be discussing alcohol and its interactions with other medicines.
Yeah.
So
we didn't give it enough credit because we left this towards the end thinking, oh, it's easy, it's something that we normally do. But when we've researched it, we found out there's a lot more to it than what we first realised.
Yeah.
And that sort of leads me on to think, well, asking you, what were your implications or thoughts about alcohol and its interaction with medication?
Obviously, I had to go back to when we were in university. It's something that you obviously get taught in the first 2 years because it's more to do with sort of kinetics and the kinetics of medication and stuff like that. So metronidazole was the first one that popped into my head. Probably the most common one that you would get taught in university. And then also I did sort of think about medications that act on the central nervous system and then the effects that they can have on alcohol. So it wouldn't be a pharmacokinetic interaction, but I knew that there obviously was an interaction with those medications. And like I said last time, it's one of the most frequently asked questions that I get asked from my family and friends. You know, they don't really tend to ask me much, to be honest, and to do with pharmacy, but it just started on an antibiotic in particular. The question that they'll ask me is can I drink with this antibiotic? Well, what about yourself?
They were the same, and I've always remembered paracetamol. That always interferes with alcohol, which we'll get into. And I think it's good to mention the types of interaction, like you just said. So there are 2 types, one of them being pharmacokinetic and the other one being pharmacodynamic. Yeah. Do you want to explain them?
I can do, yes. So pharmacokinetic means an interaction that will actively interact with the medication. So it will either change the metabolism of the drug or it will alter sort of how it's eliminated or...
Yeah.
It's
to do with how the body interacts with the drug.
Yeah, so it's specifically to do with that, whereas pharmacodynamic is the drug will enhance the effect of another drug. So if we're thinking about alcohol, we know that alcohol is a CNS depressant, and so if you take it with another medication that can cause similar side effects, it will potentiate the effects. Do you reckon that was good?
That's it, explaining it. And I think it's best that we start by going into medication that a lot of people will buy over the counter, because a lot of medications that we will discuss in this are normally prescribed for set cohort of patients. So I think it's good to start with things that people are going to purchase. Yeah. One of them that you may not think of are antihistamines. Yeah. So you brought that up in terms of they do tend to cause drowsiness. Yeah. Now we do have 2 different categorizations where you've got non-sedating and sedating. Yeah. But in reality, they do all cause some sort of sedation. Mm-hmm. One to look out for?
So chlorphenamine is the main one, which is a drowsy antihistamine that you can buy over the counter.
The brand being Piriton?
Yes. Yeah. Then we've got cetirizine and loratadine. They're another 2 that are common. They're non-sedating antihistamines, and so they shouldn't have the same effect. However, like Lee said, you still can get the sedating, and especially if you're using it alongside alcohol, just be careful about that.
Yeah, and in terms of looking at alcohol-induced liver disease, it can affect the metabolism of these antihistamines as well. So if you are a chronic drinker who's got damage to the liver due to drinking, then that can affect the metabolism of antihistamines and other medication. Yeah. So that is something that's across the whole board, because if you actually look at the interactions with alcohol, there's over 320 listed. Yeah. And it's mainly due to that mechanism about affecting its metabolism through the liver.
Yeah, and I was going to say as well that most of the medications that we will discuss in this podcast are, and the interactions with the medication is usually studied in patients who are chronic drinkers. So it's not usually studied in patients who are moderate drinkers or also binge drinkers. Now, we do know that a lot of the pharmacodynamic interactions, so the interactions where they'll potentiate the effects of medication, that will affect binge drinkers. However, the pharmacokinetic, as we will get into, may not affect binge drinkers as much as what it would if you were a chronic drinker. So that's just something to bear in mind.
Yeah, okay. Another one Another class of medication are anti-inflammatories.
Yes.
Most commonly you will buy ibuprofen. You will use it for inflammatory conditions, you will use it for headaches, etc. Now, the way this interferes is that if you go back to previous episodes that we've done, alcohol directly irritates the gastric mucosa, so the lining of the stomach and the intestine. Anti-inflammatories do that by nature. Ideally, you should consume them with food.
Yeah.
But also, the way they work is that they reduce the mucus layer that protects the gastrointestinal tract.
Yeah.
So with the anti-inflammatories doing that, plus alcohol's irritant nature, and the fact that alcohol does increase gastric acid production, you've got an increased risk of gastritis, gastric bleeding. So that's where the interaction comes from. Yeah,
and I think ibuprofen is an important one because a lot of people will tend to take ibuprofen after a heavy drinking session because you get a hangover, you get a headache, things like that. So it doesn't mean that you can't take it, but it's just to be mindful that, you know, you can get side effects from taking that medication alongside alcohol.
And if you are going to take it, at least have it with some sort of food.
Oh, yeah.
And that's one thing that you don't tend to do when you drink a lot of alcohol, is that sort of left to the last minute, isn't it, at the end of the night. Now, the last one, the part of the things that you would buy is paracetamol. Now, this one is actually interesting. And when you look into the studies of it from university and now, there's still a bit of conflicting evidence over it. But this is where I want to introduce how enzymes work, which may sound boring to some. But you said pharmacokinetic, and that is how the body metabolizes the drug. So alcohol can increase the level of enzymes in the body, mainly in the liver. And
when you're a chronic drinker.
When you're a chronic drinker, yeah. So an enzyme is a protein which can assist in a reaction, basically. So in terms of drug metabolism, you've got this class of enzymes called the cytochrome P450 enzymes. Each one of them will be denoted by, we'll call them CYP for short, and then they'll have numbers and letters after to denote a particular enzyme.
I think there's 57 in humans.
I don't know that.
Yeah, I've found that out.
So you can increase the level of production of these enzymes, or you can inhibit them. And the way that they work is, if you increase the amount of enzyme, that will lead to increased metabolism of drug, which will reduce the levels within the body. Conversely, if you inhibit an enzyme, it will increase the amount of drug within the body because you're not metabolizing it. So in terms of alcohol, when you're a chronic drinker, you increase the levels of CYP2E1, which is involved in alcohol metabolism for 25% of it, and it's involved in the paracetamol pathway. Now, without going too far into it, paracetamol, once it's converted via CYP2E1, which is only about 10% of the time, it goes to this toxic metabolite called NAPQI. NAPQI can then attack your mitochondria, and it can cause a lot of adverse effects. Now, the body gets rid of this by quenching it with another substrate, glutathione. I'm not going to go into it too much, but alcoholics, they don't have too much glutathione from the diet, so that NAPQI is allowed to roam around the body, basically. Now, if you're inducing that through chronic alcoholism, you are going to increase the levels of production for paracetamol. If you are a binge drinker, it can inhibit it. So let's say you go out on a night out, you have 2 to 4 tablets in a night, you're not metabolizing it, then you wake up in the morning, your body has no effect of alcohol, then it can metabolize it more, so more NAPQI could theoretically be produced. But my point is just to monitor your usage of paracetamol when you are drinking in any capacity at some point.
You know, it can become people think of it as a safe medication, which it is when taken correctly, but it can be very toxic, like you've just said, to the body. So to just be careful about that. And it won't, obviously, I don't think it states on the label or on the box to not drink with alcohol. Obviously, don't quote me on that, but usually when you're working in a chemist, there's like cautionary labels that will be put onto medications, and I don't think that alcohol
it might be in there somewhere, but it's not emphasised.
It's not emphasised. That is the point. But
they're the main medications that you will buy over the counter. And if you are still here and I haven't bored you to death through paracetamol metabolism, the next class of medication we want to go on to are CNS, so central nervous system. And the main effect being its depressant effects of alcohol, and it potentiates the other effects of these medications. So you're looking at ones such as opioid medications or pain relief, whether that be nerve pain relief, so pregabalin, gabapentin. You've got antidepressants, which they work, amitriptyline, SSRIs. You've got
antiepileptics.
So
phenytoin, that also is affected via the CYP enzymes as well, but lamotrigine, levetiracetam, phenobarbital, again, that's another one that's also affected by the CYP enzymes.
There are a lot.
Yeah.
And the biggest thing to take home from this are that if you are already on sedating medication, that you shouldn't ideally drink with them. And it's not that a lot of people ask about this if they're on certain medication, so amitriptyline, can they drink on it? You can drink on it, you're not going to get a violent reaction.
Yeah.
I think that's what a lot of patients are looking for. Are you going to be violently sick if you take this? You're not.
Yeah.
But then in terms of impairment, respiratory depression, all the side effects of overdosing in terms of opioids and certain classes of medication, they're going to be potentiated, and the risk is going to go through the roof. And that's all it is, really.
Yeah, I think the biggest or the most serious side effect that would come from that would be, like you say, respiratory depression. So obviously our respiratory system and the way we breathe is monitored, or it's controlled by the central nervous system. And so if you completely cut off your central nervous system and depress it down that much, it can cause respiratory depression, which then will obviously ultimately lead to death. So that's the most serious consequence of having these medications together. And and you should definitely think about that before you taking alcohol with any other medication that's going to suppress your central nervous system.
Yeah, and there's one thing that I looked into was, so those who take morphine in a slow release preparation, if you drink alcohol, it increases the release from the slow release. So ideally it's meant to go over 12 hours, but it'll just spike it all within a couple of hours, and it's classed as severe in terms of severity.
So dangerous.
It is.
Yeah.
I didn't know about that.
No, I didn't until you said to me. We were very interested in that one, wasn't we? It was funny as well, because I actually have had a couple of patients over the last couple of days where they've been seen in gastro clinics because they've got chronic alcoholism, and they've been started on medications where I'm like, oh wow, it's like I know that interaction now, where you maybe wouldn't have picked it up. Obviously you're always aware of it, but you don't really realise the severity of it until we've done this.
Yeah.
So it's just so interesting. I think this is like one of the best things we're doing these podcasts is we're learning constantly while doing them. You're just going back over all of the stuff that you did in university. It's interesting.
That's what we said about this one. When we looked at it from the outset, we were thinking, there's only a couple of medications that truly interacts with, but in reality, over 320 and counting.
Yeah. And again, it's different as well, like we said before, in terms of if you're a binge drinker, you're a moderate drinker, or you're a chronic drinker, it affects it in different ways. It's so complex,
it is.
Like everything in medicine. Okay, so then the next group of medications, and the one that, like we say, is probably the most commonly associated with interaction between alcohol, is anti-infective. So antibiotics, antivirals, or antifungals. So the biggest one, and the one that I mentioned at the beginning, is metronidazole. So this is the antibiotic that is most associated with this violent reaction. So do you want to explain what happens or why we get a violent reaction with metronidazole?
Yeah, so when we've been through previously, alcohol is metabolized to acetaldehyde through alcohol dehydrogenase. Yeah. That is further metabolized to acetate through aldehyde dehydrogenase. It's that acetaldehyde that forms the violent reactions that you get of a hangover. Yeah. Now, there's one medication that's called disulfiram. Yes. Brand name Antabuse, and it was first brought in. It's more of an abstainer. Yeah, really. I think it was actually... It's quite torturous, really, when you think about it. Yeah. Is that you give it to patients who drink a lot of alcohol, and the idea is if they continue to drink whilst taking it, they go into violent hangovers. Yeah. So the idea is you will eventually learn not to drink because of the side effects. Yeah, so you get things like tachycardia, panic and distress, you get hyperventilation, really, really unpleasant side effects. Yeah, it's not nice. No. And that's what's classed as a disulfiram-like reaction. So if you ever see that on any medication, that's what it means, is that it's leading to the same effect that Antabuse does have. Yeah. Now, this works by inhibiting the aldehyde dehydrogenase enzyme. So it inhibits the conversion of acetaldehyde into acetate. Yeah, so you're building up more acetaldehyde. Now, metronidazole does inhibit that enzyme, which is why we get a big build-up of acetaldehyde, and that is why it is probably the most common one. It's normally used for dental infections and bacterial vaginosis and certain... Yeah. It's mainly anaerobic cover that it's given. So yeah, that's the main one. I think you also said, was it ketoconazole? Ketoconazole was one of them. Was another one. Not really something that you tend to see that often. You'll see it a lot in terms of, topical application for like psoriasis or,
like dermatitis and things on your scalp, don't you?
You can use it for Cushing's syndrome.
Yeah.
But that's one of them reasons. I'm trying to think of another one. I mean, some of the papers were saying some of the cephalosporins, depending on the generation. So that is a group of antibiotics which normally don't have that. Well, I didn't associate with that reaction. So there's quite a lot of medication that do tend to have a disulfiram-like reaction or have been reported to. The biggest one to look out for, though, is definitely metronidazole.
Yes.
And yeah, like you said, it's given for dental infections, vaginosis, and it's given in a lot of gastric infections, which is a lot of patients who are in them wards tend to be drinkers anyway.
Yes. But I think with all anti-infective medications, and I think the biggest point to take out from this is that ideally, you know, if you're on an antibiotic and you have an infection, your body is under some sort of stress, and it should be utilising all of its energy to be able to fight off this infection. If you are drinking alcohol, we know that it uses NAD, which is involved in a lot of metabolism and a lot of reactions within the body. And so if your body is trying to get rid of alcohol, it's then not able to focus on other things like fighting infection. We also know that chronic drinkers are typically, you know, they have a poor immune system. It's like obviously a lot of things. Maybe they have, you know, poor nutrition, things like that. But you know, so if they've already got a poor immune system, if you're a chronic drinker, then continuing to drink whilst taking antibiotics is not a good idea.
Yeah, that's a big thing. And like we've said before, patients mainly look for the idea, is it violently going to make them sick?
Yes.
And there are going to be antibiotics that won't cause that, but the biggest thing is they're not going to be as effective and you could be sicker for longer.
Yes. So then we go on to the cardiovascular system. So there's a lot of drugs that affect this system. So things for hypertension, we've got medications for angina, any other ones that you can think of?
Blood thinners.
Blood thinners, oh yeah.
You've got quite a lot. But going on to blood pressure first, this is quite a paradoxical thing because over long term chronic use, it does cause high blood pressure. Yeah. But then in short term and in certain environments, it can cause low blood pressure. Yes. So the biggest interaction with blood pressure medication is that it causes low blood pressure. Yes. Which seems counterintuitive, doesn't it?
Yeah. Also, there's with isosorbide, which is usually used for angina, it's an anti-anginal, and also doxazosin, which is an alpha blocker, which is further down the pathway of hypertension, but will be used for high blood pressure. It can also cause orthostatic hypotension, which means that when you stand up, you get an instant drop in your blood pressure. So that was what came up with the interaction with those two medications specifically. But yeah, like you say, with a lot of the other hypertension medications, it's just that the combination causes low blood pressure, which obviously is not good. It can increase your risk of falls, it can make you dizzy, so it can affect your quality of life really. Yeah. Blood thinners, so a similar mechanism to what we discussed with ibuprofen. So if you're on blood thinners, they will increase your risk of bleeding anyway. Alcohol, we know, is a director into the gastric system. It also inhibits prothrombin, doesn't it? So that was a long-term effect of alcohol. So it can increase your risk of bleeding further if used in combination.
Yeah. You're looking at me,
I know, because you were looking at me.
I'm just listening to you. For a minute.
Any others that you wanted to go through with in terms of that? Actually, another one that I wanted to discuss was that alcohol can increase your risk of atrial fibrillation. Okay. So atrial fibrillation is a cardiac arrhythmia. Gets more common as you get older, but it can increase your risk of a stroke. So if you've already got an underlying heart condition such as hypertension, that increases your risk, and then if you're obviously drinking on top of that, you're just going to get even more of an increased risk. So yeah, just something again to be wary of. Yeah. Then the last one that we've got on our list is diabetes. Yeah. So
alcohol does inhibit gluconeogenesis, meaning that it causes low blood sugars. So if you are on any diabetic medications, it can lower your blood sugar anyway. And then when you do normally drink, you are masking the symptoms of hypoglycemia. So then it's just dangerous really if you are diabetic or a very poorly controlled diabetic drinking.
Yes. So I think the specific ones then to look out for are anti-diabetic medications that will cause hypoglycemia. So the main one that jumps to mind is gliclazide, sulfonylureas. So that's the class of medication. However, you have to be careful with all anti-diabetic medications. Another one as well was metformin. So metformin doesn't actually cause hypoglycemia as a side effect. However, it can cause lactic acidosis, and it's contraindicated in patients who have lactic acidosis, which is a buildup of lactic acid. Alcohol itself can increase your lactate in the body. So again, just another thing to bear in mind.
Yeah.
Yeah. And then, is there any other medications that spring to mind? I feel like we've gone through a lot. Very whistle-stop tour. Again, you know, the mechanisms behind why these things interact is so complex, which we're not going to get into the podcast. But
we did touch upon it a bit.
I feel like we have, yeah.
But there are, like we said a couple of times, there are so many interactions with alcohol. It's just being wary and mindful that some of them, a lot more medications than what you anticipate, will interfere with alcohol. Yeah. And you've got to do a trade-off in terms of, yeah, it may not cause violent reactions acutely, but it might halt your progress with your medical treatment going forward. And they're things that you've got to do when it comes to risk analysis.
Yeah. But anyway, thank you for listening to this podcast. We hope that you enjoyed it, and we will catch you on the next one.